An opportunity for discussion. This is the 15-Minute Wonder on Southwaves Radio.
Hello everyone, welcome back to Dr. Chan's Minor Ailments Forum again. I've had a very busy week this week, and I've been thinking about what to talk about as a topic this week, and I think I would choose to talk about chickenpox and shingles for these 2 coming weeks, because I've been seeing quite a lot of late presentation of shingles at work in the past week or so, and I'm a bit worried because shingles, you know, is quite a painful disease, and if you get it treated really late, then it could have more complications. So I can't really talk about shingles without talking about chickenpox, because although they're not directly related, but shingles is basically the reactivation of the virus after they lay dormant in our spinal cord. And it tends to happen when we're a little bit run down or our immune system is low. So in that case, maybe before we go into talking about shingles, it's best to talk about what is chickenpox and how it presents and its complication and so on and so forth. So the next week when we talk about shingles, we understand it a little bit better. Now, chickenpox is basically very infectious, and it's caused by a herpes virus called varicella zoster virus. So when you hear chickenpox, you immediately think about only children get it, or mainly children get it. And it's correct, because 90% the people who are affected, it tends to happen before adolescence. And when I say this disease is quite infectious, because nearly 90% of the vulnerable individuals who came into contact with chickenpox tend to get chickenpox. And vulnerable people would be people like, for example, they've got low immunity, for example, if they're elderly or they are going through cancer, etc. Now, it's important to talk about how chickenpox actually presents. I know probably most of you know about what is chickenpox and whatnot, but it's good to go through it just quickly. So, in some cases, like myself, you might have no symptoms whatsoever. I kept on thinking that I've never had chickenpox before, but when I went into medical school and they do blood tests to check whether they need to give you injections of, for example, hepatitis B and so on and so forth, I told them that I don't think that I ever had chickenpox. And for medical professionals, if they're going to work with patients, they tend to check your blood to make sure that you either had chickenpox, or if you don't, then they might give you an injection to protect you. So that's what I wanted, to have an injection. But they said, well, look, let's do a blood test first and see what's going on. And funny enough, I must have had chickenpox at some point in my life, because I've had the immunity. But I've never had any symptoms. So let's quickly go through how it would present. So let's just say if somebody's been in touch with a chickenpox virus, the symptoms and signs don't come up immediately. So it might come up around 10 to 14 days, so what we call incubation period. But sometimes it can last or take up to 21 days until the symptoms come on. So first of all, most people would get a high temperature, and they would realize that they've got some vesicles or blisters coming up on their skin. And they tend to come up as crops. So it's not just 1 or 2, but it's a bunch of them in different places. And you will see them mainly on the face and the body, and the arms and legs will have some, but will be less than the core. So once the blister came on, they would tend to slowly crust it off, and that would generally take about 3 to 5 days. So once the rash and the blister have crusted off, then we can say that probably is the end of the illness. Then the patient tends to slowly get better. I think one important thing that we need to think about is when is it most infectious. So you are actually infectious when you contracted the virus, and especially on the first day and the second day when the blisters start coming up. And by the time all the rash and blisters have crusted off, then it's probably safe to say that you're not infectious anymore. So you might ask, well, so now I've got chickenpox, what do I do? What is the treatment for it? Most of the time, the treatment is only symptoms control, especially this illness actually self-limiting. So generally speaking, after the 3 to 5 days that the patient's starting to feel better, the rash has been crusted, then you should be all right. The most important thing is to ensure that the patient needs to drink plenty, and obviously the rash will be itchy and also sore at time. So we need to make sure that the patient will take on board pain control and antihistamine to control the itch, etc. Calamine lotion can be considered as well as a topical treatment to kind of soothe the skin and just keep it cool, especially during the night, because when you're sleeping it can be quite itchy and you might be scratching your skin without knowing. Now, generally speaking, there's no other medications are needed for chickenpox treatment. But in some cases, an antiviral medication, for example, a drug called acyclovir, can be prescribed if the person is actually high risk of getting complications. Now, who are the people that we considered being high risk? For example, anyone who's immunocompromised, patient who's got HIV with low CD4 count, people who's got blood-related cancer, or patient with organ transplant, etc. And it's important to think about people who are on high-dose steroids. Now, the example would be if any children who are on 2 milligram per kilogram per day of steroid for more than 14 days, or adult who's on 40 milligram of steroid per day for more than a week. As I said earlier on, after day 5 or so, if the rash has been crusted off, then it generally is safe to say that the disease has run its own course. But in some certain cases, you might realize that the rash crusted off and a new lesion comes up again. So if anyone who's got new lesions appearing after 8 days of the illness, then these people will be counted as high risk as well. And now when we're talking about high-risk patients, I would like to talk about pregnant ladies. So why am I so concerned about pregnant ladies who's been in touch with chickenpox virus or actually have chickenpox? Now, because if a pregnant lady has caught chickenpox during the pregnancy, then potentially it can lead to something called the fetal varicella syndrome. And this syndrome is related to potential fetal developmental problems, for example, intrauterine growth restriction, cataracts, etc. Quite a few other points. So in women who caught the virus within the first 20 weeks of pregnancy, it's been shown that there will be less than or equal to 2% chance of getting congenital varicella syndrome. Now, on the contrary, if you caught this the virus after that, then it can potentially cause premature delivery or even neonatal chickenpox. So that's quite serious. And this happened in particular if the mother was infected within 7 days prior to giving birth. So number one question that you have to ask yourself is if you have chickenpox or if your children have chickenpox, but they might have had an encounter with any pregnant ladies, then you need to let them know. Because if they have had chickenpox before, it's likely that they would have immunity to protect themselves from getting chickenpox again. But if they have never had chickenpox before or they can't remember, then they definitely need to go to see the GPs immediately to get a blood test done to check for immunity. Now, although I said that once you had chickenpox before, you might have the immunity, and you generally do, but I have seen some cases that someone had chickenpox when they were a kid, and then later on, when they're adult, developed chickenpox again. So that I can't verify it. But it's better to be safe than sorry, so always attend to see the GP if you suspect any exposure to chickenpox if you're pregnant. So if you think that you have chickenpox and you're actually pregnant, as I said, you need to go and see your GP ASAP. And what the GP would do is have a chat with the specialist to see whether you need to be started on an antiviral medication for the chickenpox. Now, this antiviral medication tend to be a week-long medication. And it's only or should only be started under specialist advice. Especially you have to be a bit cautious if you're using it for the first 20 weeks of pregnancy. As you know that being pregnant, you probably are not able to take too many different kind of medications because they've never done any medical trials on quite a lot of medications, so they can't ensure that the medication that they're giving you is safe, but this will be the advice from the specialist. So there's quite a few things to consider really when you suspect you have chickenpox or you suspect that your family members have chickenpox, because when you call up to the GP surgery, it's probably worth just mentioning, I think it might be chickenpox. So just say it anyway, because if that was actually chickenpox and there were some vulnerable people waiting at the waiting room, they might have the opportunity to contract the virus and get very unwell. And in that case, for example, if you said that you suspect yourself having chickenpox or having a funny rash that you worry about, generally speaking, the receptionist would try to find a room for you to stay in order to have an isolation to protect other people. It's also important to look out for complications of chickenpox because, as I said, although this is a very self-limiting disease, in some circumstances or in some people it can cause quite serious complications. So the potential complications are, for example, infection of the blisters that might need antibiotic, or the virus might actually affect the brain, causing encephalitis, which is inflammation of the brain, or meningitis, etc. And there are several signs that you need to look for these kind of complications, and it can be potentially serious. For example, they might present with seizure or stiff neck. Sometimes they get very confused and drowsy, and people who's got a weak lung, for example, they already had asthma or COPD, might actually present with pneumonia. So the bottom line is, if you worry about any complications or you think that you've got complications from having chickenpox, it's very important that you present to your GPs ASAP to be assessed. Now, I'm just going to end this show by telling you a little bit about exclusion from schools or work. So I think it'll be wise to say that if you have chickenpox or if your children have chickenpox, it's important to stay away from any other people in order to prevent infections. So if you can see that your rash or your blisters have completely crusted off, then it probably would be safe to say that you can return to school or work. And also you need to be careful with the family members as well, because obviously they're living with the person who's got the chickenpox and they might catch it as well if they haven't had it before. So it's a good idea not to share anything like, for example, personal items, towels or underwears or socks, etc., because you can easily catch the virus from there. So as a quick recap, chickenpox is very common yet infectious disease, and generally speaking it's self-limited, but it can potentially cause serious complications. So in any case, if in doubt, always go and see your GP to have a quick discussion. In that case, you can ensure you get the peace of mind and also won't cause any delay of recovery. So next time when we meet, we'll talk about shingles, which is a reactivation of the herpes zoster virus. And if you tune in next week, you'll see why I'm worried about people presenting with shingles late because of its potential complications. Until then, have a very good week and look after yourself. Bye-bye.
An opportunity for discussion. This is the 15-Minute Wonder on Southwaves Radio.